Hello, this is Sheila McAndrew. This is the final interview CTS with PUI training video. I'm going to go over what your CTS dashboard looks like, some of the key points to remember, as well as a mock interview with a test PUI. In this case, you should see my CTS dashboard. Up here, you will see your CTS status in red when you're first assigned a PUI. In this case, my test PUI is John Test PUI. And for me to see his information, I would simply click on View PUI on the left side of the screen. And this is the information that I will see. I will see the intake information is not being reviewed, meaning no one has reviewed this person. You are the first CTS to review that individual. And if you scroll down like I am, under the notes section, this is usually where you will see information provided by Larkin on when the person took the test. It could either be a drive-through or other means, the date of that test, and that it was assigned to you. If you scroll down further, you'll see the person's name as well as their contact information. The contact number is the phone number that you would call, and usually this is filled in. However, there are times when the person does not give a phone number, or they could have given the wrong number accidentally, in which case the email is very important. And here you will see the email address of the person. And through the COVID Fighter app, we can easily send an email by scrolling up to the top of the page where it says send email. Now, if you click on choose email option, you'll see that there's different email templates already created, and information on that will be available on the CTS guide. In this case, if the person that you're trying to reach does not have a phone number, you can simply click on the bottom where it says custom email, and you can go ahead and either type in any email that you'd like with a subject title, or in this case, if the person does not have a phone number, you can simply go to the CTS guide and look at section 6 under potential situations, and there's actually a template there that's called no phone number, and you can simply copy the language and paste it on here. So in this case, I'm just going to type in information on here that says test copy, in this case, of an email. And this is an actual email that will go out directly to your PUI via the email that's on the profile. And in here, you can put a subject if you'd like. I'll just go ahead and put test for now. And one of the key things that's very, very important is this email is going to be coming from a generic email address. And so it's very important that you go ahead and put your full name at the end, so that if your PUI responds, there is a person at Larkin who's also a volunteer like us, who will forward the email directly to you. And so in this case, again, go ahead and make sure you put your full name so they can easily track you down. And then when you're done, simply hit send, and your email would be sent. To make sure that you remember that you sent the email, best way to do it is go ahead and add a note. And I just clicked on the edit next to note. Again, let me just show you that again. Under notes section, hit edit, and this screen will pop up, and you just add the notes. And so what I usually do is put a date first to denote what day it is, and then the note that you'd like to put in. So sent no phone email, and hit enter, just so that there's an extra space, easier to read. And then when you're done, simply hit save, and you'll see at the bottom it says notes updated, and you can see immediately on the notes that you sent them, you added the note on there. Other things to note on this profile. So when you're looking at the candidate, looking at the PUI, you'll see intake information says not reviewed. Once you've reviewed it, go ahead and put reviewed. This shows that you have already reviewed the information and you're working on this PUI. Because we've already sent the email, or if you've made your call or in the process of making that call, you can go ahead and put PUI status and then select from the drop-down PUI interview in process. Before I click on that, just take a quick note of the different statuses that you can use here. And we're going to go through some of that. If for some reason you do talk to a PUI that speaks a different language, you can simply select different language. You can click on that, and that will automatically notify that your PUI speaks a different language and that they need to be assigned to a native language speaker of that PUI. And again, you can simply just put on the notes what language they speak. But in this case, we haven't talked to the PUI. We don't know anything other than it's in process. You've reviewed their intake information, and now you're ready to call, and just click PUI interview process. The rest of this is what we're going to be going over when we talk to the PUI. You'll see the COVID-19 questionnaire here, as well as the plasma donation and peer support information, and if they want to become a contact tracer. So in this case, we're going to go ahead and begin our phone call and go through the mock interview with your PUI. I'm going to go ahead and call John, and I'm going to go ahead and dial his phone number. And the phone's going to ring, and we're going to go ahead and begin with our mock interview. Ring, ring.
Hello.
Hi, is this John?
Yes, it is. Who am I speaking to?
Hi, John. This is Sheila. I'm a volunteer from the Larkin Community Hospital Coronavirus Response Team. Is this a good time to chat?
Sure, but what are we talking about?
Great, thank you for your time. I just wanted to go over some questions that I have for you and wanted to talk about any concerns that you have regarding your recent test. Is that still okay to talk today?
Yeah, sure. How long will this take?
Not long at all, but if you do have questions, I want to make sure we go through all of that. But if not, it should be pretty quick.
Okay, all right, we'll give it a go.
Is that okay? Okay. Yeah, Great, great. Now, first I see here that you had a test on Monday. Is that correct?
Yeah, that's when I took the test, yes.
Okay, great. Can you verify the location for me?
It was in Palm Springs at the Larkin place.
Perfect. Okay, perfect. Thank you. I am sorry that you're going through this. How are you doing?
You know, it's like this is it's kind of worrisome. I hope I do okay. I just have, you know, some bit of flu-like feelings, but you know, I'm hanging in there.
Okay, okay. I hear you, and I do hope that I can offer you some support during our call today. Okay, I know that this is very worrisome, and I'm hoping that we can talk through some of the things that you might be worried about. But first, I want to just clarify, I am calling as a volunteer and not as a healthcare provider. Okay, but I do want to make sure we go over some information that will help stop the spread. And throughout the conversation today, I do want to reassure you that everything we go over is going to be kept confidential between you, myself, and the hospital. Okay?
Yeah, sure. Great. Thank you.
Okay. All right. So the health department is probably going to call you because this is a highly contagious disease. Have they contacted you yet?
Nope, nobody's called.
Not yet. Okay. We'll be going over some things that they're probably going to also want to know. And so I'm hoping that what we go over today is going to help you when they do call. And we actually have an app, and I can walk you through that. And you can actually see the information that I type in the app, and you can also actually complete this app as well. And so when the health department calls, you can simply log in and share any information you'd like by looking up the information on the app. Okay, so we'll go through that with you today.
Okay. How do I get this app? What,
Well, I can show you now. Are you near your email? Do you have access to email?
I do, yes.
Perfect. I'm going to go ahead and send you a couple of emails, and it's going to just be a quick click first to email to verify your email. Let me know when you get that. Just click on verification of your email. That just makes sure that the email I have for you is correct.
Okay. Okay.
You got it?
Yeah.
Well, let me just double check here. Great. I do see that your email was verified. Thank you. And then the second thing is, again, I mentioned that this is going to be confidential. And so I want to make sure that you have secure information or secure access. I'm going to go ahead and send you a password reset. And just click on that link for me and go ahead and change it to a password that only you know.
Okay.
And let me know when you're done updating your password.
Okay, that's done.
Perfect. Now I just need you to go to the internet for me and go ahead and type in covidfighterapp.com.
COVID fighter app. That's with 2 P's, right?
Yes.
Yeah. Okay. Yeah, got it.
Perfect. And on there you'll see sign up.
Yep.
Or sign in. Go ahead and hit sign in.
Okay.
And go ahead and use the email address that you have and the new password that you created.
All right. Yeah, got it.
Perfect. Go ahead and you'll see terms and regulations on there. Go ahead and go through that. You're welcome to read it. When you're done, you can scroll down and agree. And essentially, it states that everything that we go over today is going to be confidential. And so when you're comfortable, hit agree, and you should be at your dashboard.
Okay, yeah, here I am.
You see it?
Yep.
Awesome. Good. You're good at this. Much better than I was. And so you can just see that there is a section that says profile.
Okay,
Go ahead and click on that. It'll say user profile, and you'll see the information on there. Just verify for me that all that is correct.
Okay. Do I need to fill in these questions like gender and all? You need that?
If you're comfortable, yes, that would be great.
Okay.
Okay.
Yep.
And then,
yep.
Perfect. Let's see here. Great. I can see you actually update the information, so I appreciate it. One really cool thing about this app is you and I can see the same thing. And so when I update information, you'll be able to see it. And so actually, if you want, we can go through it together right now, where it says the questionnaire for COVID-19. So it says on there, when did your symptoms first begin? I know you took the test on Monday. Tell me a little bit about that. When was your first symptoms?
It was, yeah, Friday I started feeling kind of bad.
Friday. Okay. What were you feeling? So that was on the 24th?
Yeah, just, headachy, kind of flu-like. And then, the next day I woke up and had a fever.
Okay.
Had a cough.
Okay. All right. So let's go ahead and put the symptoms on when it first began. So let's see, actually, that would be on the 17th. Is that right?
Yes.
Okay. And so go ahead and put July 17th. It looks like you're doing that now. That's very good. And then just hit save.
Okay.
Okay, very good. And then your symptoms. So you said you had a headache.
Yep.
And a fever.
And a cough, yeah.
And a cough as well. Okay, very good. That's pretty easy, huh?
Yeah, right. Cool.
Okay, very good. So let's talk a little bit about your household here. It says, including yourself, how many people live in your household?
There's two of us.
Two. Okay. So I'm going to go ahead and you can see me update it. I'm going to go ahead and put that there's two of you on there and I'm going to hit save. Can you see that update on your end?
Yeah.
Yeah. Perfect. Good. I went ahead and also updated this where it says, have you been contacted by the health department? Not yet. And again, if they contact you, they'll be asking similar questions and you just log in just like you did today. And you can just look here. You don't have to memorize any of the dates because it's already in here. So it makes it easier for you.
Cool. Great.
Okay, good. So let's kind of begin with some of the questions that I had. And again, if I know you said that, this whole situation is a little worrisome for you. And so I'd like to talk a little bit about that as well. Tell me a little bit about your home situation and are you able to isolate and how that's working out?
Yeah, I live in a pretty small house, and so it's kind of hard to be completely isolated.
Okay.
So, I try to, just stay in bed, but that gets kind of hard and boring, and I have to, share a bathroom, and if I wander out into the kitchen to get anything, so it's kind of hard to be completely isolated.
Right, I understand. You will only have one bathroom probably too, right?
Right. Uh-huh.
Okay, okay. And is that what's the most worrisome for you?
Well, my wife will get it.
Right, right. How is your wife doing?
Yeah, she's doing okay. She hasn't shown any symptoms.
Okay, very good, very good. Well, it sounds like you're starting off on the right foot. You're aware, you're isolating yourself at home. Now you mentioned that you're staying in bed. Is it because you're not feeling so well and you feel like you need to stay in bed, or are you able to go outside at all
Oh no, I
to get
haven't.
some fresh air?
No, I'm trying to stay, isolated, and it's just so hot down here. I don't want to go outside.
Right, I don't blame you. At least you have air conditioning, right?
Yeah.
Yeah, okay. When you do share the kitchen and the bathroom and things like that, are you able to wear a mask and your wife able to wear a mask as well?
Yes, we both, if we're near each other, we both wear masks, and she's got hand sanitizers and wipes all over the place. So we're
Great.
doing what we can to keep things wiped down. And
Very good. Well, that's definitely you're doing everything that you can at this point. It sounds like you're being very diligent with that. Anything else that might worry you about being isolated at home?
no, I think that she takes the dog for a walk, so that's taken care of.
Good.
And is trying to, she's been talking with her boss to not have to go to work, but that's been worrisome. But she, it's a little bit scary because she doesn't want to go there and people stigmatize her because I've got because I'm sick. So
Right.
she's tried to not tell people, and that's hard because she needs support. So I feel like on one hand we're living a lie and we're trying to protect other people, and yeah, it's just really hard.
Right. I hear you. Well, one of the things that I would be happy to do is also spend some time with your wife so that we can talk about any concerns that she has. And maybe I might be able to connect her with someone that can help her with her work situation as well, so that you don't feel like you're living a lie. This is tough and you're not alone. We're here to help. And again, it sounds like you're doing everything you can to keep your wife safe by wearing the mask and using hand sanitizers and sanitizing, the doorknobs, I guess, is what you're doing, and counters. Is that right?
Right. Yeah. And she's pretty good. When she goes out, she always wears a mask because it's about protecting others. And, she wipes down she carries the wipes with her and hand sanitizer because, she's also concerned that she doesn't transmit it to somebody.
Right, right. Now, has she gotten the test?
No, she hasn't been tested. No.
Okay, okay. Do you think it would be a good idea for me to chat with her and just go through to make sure that she doesn't have any questions that I can answer and
Oh, she's not
maybe
here right now.
provide some?
She's not here right now.
Okay, would you be okay for me to call her later?
Yeah, that'd be okay.
Okay, all right. Um, what is your wife's first name?
Debbie.
Debbie. Okay. And you'll see me update your profile here on the COVID Fighter app, actually. And I'm assuming she has the same last name?
Yeah, Test.
Okay. Test. Perfect. And what would be the best number to call her later?
333
Uh-huh.
333 3333.
Perfect. And so I'm actually, I don't know if you see me update this information. I'll show you in a second here. And I'm adding some notes based on our conversation. And you can actually see the notes that I type in this section of the app. Let me know when you see that.
Oh yeah, okay. So how did you do that? How did you get there?
And so I actually just on the profile, there's two ways you can add it. One is actually when you first log in, you'll see that you can easily add a contact or even add a location, which we'll talk about in a minute. Or simply here, right under the COVID-19 questionnaire, you should see where it says identify all the people you have been in close contact with, and you can
Right.
just simply hit add.
Oh, okay.
And then a screen will pop up.
Gotcha.
And you can go ahead and type in her information. So I'll just give her a call today and reassure her that you and her are doing the right things at home, but also go through to make sure that everything is okay with her work situation, and that she feels that she's supported as much as needed. Larkin also has a great support team. They can help her with anything that she might need as well. And so I'll talk to her about that. Okay.
Super. Thanks.
Okay. All right. Good. Good. Now since we're on this section of the app, let's go ahead and talk about that as well. So the app, as you can see, it says identify all the people you have been in close contact with or shared confined spaces less than 6 feet apart for more than 10 minutes. In this case, starting 2 days before you experienced your symptoms, because you could be contagious 2 days before you actually start showing any symptoms. And so in this case, we talked about the first date on the 17th. So what I'd like to do is just talk to you about the people that you might have been in contact with since the 15th. And it sounds like you've been staying home since you've taken the test, but let's just talk through that a little bit if you don't mind. And what I'd like to do, if it's okay with you, is to just, if there's anybody that you've been in contact with, just for me to just give them a quick phone call. Again, everything you mentioned today will be kept confidential between you and me. And so if I do call them, I cannot give them any information about you. I can't give them your name or that I got their name from you. And so the nature of my call will be just to make sure that they have the information that they need as well to care for themselves and others. Is that okay?
Like what kind of information? Like what are you going to tell them that they need to do?
It's simply similar to what your wife is already doing. It would be basically to try and isolate or quarantine themselves in this case. If they do have symptoms for COVID, they might need to isolate themselves, but just to walk through that with them to make sure that they are doing everything that they can by wearing masks, things like that.
Yeah, I was just with 2 people, but they both know. So
Okay.
you think it's necessary to call them? I mean, I've told them about this.
That's good. That's good. I'm glad that you told them about it. It's not required, but the CDC does recommend that people do quarantine themselves for the 14 days, use a mask, and even if they do live with other people, to quarantine themselves from other people, to also protect other people that they're close to. And so I don't have to call them, but it might be something that might be good to help them as well, if you're okay with that.
Yeah, probably hearing from somebody else, maybe it would be a good thing. So yeah, that's fine. But
Okay.
you're not trying to sell, you're not selling anything, right? You're not,
No, not at all. Good question, though. I hate it when people call me out of the blue as well. Absolutely not.
and you're not
This
putting us on a mailing list or anything like that.
No, in fact, the only information I would like from you is their phone number. And when I call them, I let them know that I'm a volunteer from Larkin and that I was notified that they were in close contact with someone who's tested positive for coronavirus. Chances are they're going to, since you've already told them, they're going to tell me that they know who it is. Unfortunately, I won't be able to confirm or deny anything other than just give them the information that I've already told you that I would give them. And then, of course, if they start, if hopefully not, but if they do start showing symptoms or not feel well, I'd like to be able to give them some information on where they can go for help. And mainly that would be CDC. And I also have a list of possible testing sites.
All right,
But this is all, this is all just to help the community.
great.
Is that okay?
Yeah,
You think that
sure.
would make
Uh-huh.
sense?
Yeah.
Okay. All right. And you're welcome to give them a heads up that someone might call them. But again, I won't be able to give them anything other than the information that we've already talked about.
Okay.
Okay. And so when were you with these two people?
It was on Friday, had lunch. I have a lunch every Friday with them.
Okay. All right. So this was, let me just look at the dates here. So that was Friday before you took the test?
Right.
Okay, so that was actually more than 2 days before your test, is that right?
Right.
Okay, but that was also the same day you started feeling
Right.
some
Yeah.
symptoms.
Right.
Okay, okay, good. So that is during the time frame we're looking at. And so the date here would be on the 17th, right?
Yeah.
Okay. So I'm going to go ahead and scroll down here on the app, and you probably can't see this right now as I'm
Yeah.
typing the information, but you will see it as soon as we're done talking about
No, no, I
these
see it.
individuals. You see it.
Yeah.
Perfect. Okay, great. Oh yeah, there it is. And so tell me about the first person that you were in contact with.
Greg
Greg. And what is Greg's last name?
Jones.
Perfect. And what is the best number for Greg?
222
Okay.
222
Okay.
2222.
Perfect. And so you had lunch with Greg?
Yeah.
Okay, so I'm going to go ahead and put the notes on here. Where did you guys go to lunch?
A place called the Melting Pot.
Okay. Where was the melting pot?
It's over on like MLK and 22nd
Okay,
Avenue.
okay. Perfect. And then who else was at lunch with you?
His name is Steve
Okay, so I'm going to go ahead and add Steve. And what's Steve's last name?
Michaels.
Perfect. And phone number for Steve?
It's 111
Okay,
111 1111.
perfect. Great. And just the three of you at lunch?
Yeah, it was just the three of us.
Okay, perfect. All right, good. And so that was the same day that you took the test. And I know you mentioned earlier that you have stayed home since you took the test.
Right.
Is that right?
Yeah.
Okay. And so you haven't been anywhere at all? Maybe
No,
groceries or?
actually, it was after I had lunch with them that I started feeling bad, and that's when I got the test the following Monday. So that was Friday. So
Okay.
I just stayed home last weekend.
Okay. Stayed home. Okay. All right. And then let's talk a little bit about 2 days before you started feeling bad then. So this was on Friday.
Yeah, I hadn't been in, that's the only place I'd been. I'd only been with, I hadn't been anywhere else.
Okay, okay. And so on Thursday or Friday before you felt bad, did you go to work, or maybe
I work from home.
you work from home? Okay, all right. Very good, very good. All right. In case you think of someone that maybe you might not remember right now, again, you already know how to add a contact on the app. Just simply help me out by adding their contact information on here, and the app will actually alert me that there is somebody else that we forgot about today, and I'll do the same thing. Just
And
contact
when
them.
are you going to be contacting them?
I was going to contact them immediately after we talked today
Okay.
because it is important that they also quarantine.
Okay.
Is that okay?
Yeah, yeah. I might just drop them a note saying that you're going to be contacting them.
Okay. Well, how about if I contact them like an hour after we talk today?
Yeah, that's fine. Yep.
Okay, just to give you enough time to do that. Okay. All right, good. So let's talk a little bit about the melting pot then. So you guys had lunch there.
Yeah.
Did you happen to run across anybody else when you were there? Maybe someone you knew?
Uh, no, just the waiter, the wait staff people, but no.
Okay. I know that melting pot is awesome because you sit there and that's where you do the fondue, right?
Right. Uh-huh.
And so was that indoors?
Yeah.
Okay. All right. Um, I'm going to go ahead and put down the information that you gave me on the location of the restaurant, just so we can also notify them. And again, I won't be able to give them any of your private information, but I'm just going to go ahead and see and add, and you can see it on the app that I'm going to go ahead and add the melting pot. Okay.
Okay. Yeah. And you're going to call them and let them know that.
Yeah, so I'm just going to give them a call and let them know that they had a customer there who has tested positive for coronavirus, and provide them the information on the date. And chances are, excuse me, I'm losing my voice. Chances are that they already have a protocol in place, but as a courtesy, it's something that I'd like to be able to do as well. Is that okay?
I mean, anything to help protect people. Yeah.
Good. Thank you for that. And while we were talking, I went ahead and found their address and their phone number. So I'm just going to go ahead and put their phone number here, just in case so I don't forget later. And then again, you'll see.
How did you locate them? How did you do that?
Oh, I simply I just used Google.
Oh,
And
great.
you mentioned that it was on 22nd Avenue. And so I just looked it up and did that here, because I doubt if you have their phone number memorized, right?
Yeah, no, I don't. I would have had to do the same thing. Thanks for doing that.
Yeah, no. So, and I'm just this app is really helpful for me too, because then I can just put all the notes here. And do you remember approximately what time you guys were there for lunch?
Yeah, we go there at 1 o'clock, so it would have been 1
Okay,
o'clock.
perfect. Okay, and you don't happen to remember the waiter or wait
No,
staff that waited on you,
no,
right? Okay,
no.
all right, that's all right. Great, and you can actually see me add the place on there as the melting pot.
Okay, very cool. Yeah.
Okay, great. Again, just to make sure I'm crossing all my T's and dotting my I's, aside from Debbie, Greg, and Steve, you haven't seen anybody else for more than 10 minutes since you started feeling bad.
Nope.
And has anybody been at your house at all
Nope.
to stop by? Okay, okay. And then aside from the melting pot and the testing center, no other place that you've been to? Can you, you think it might help to look at your calendar just to double check?
Yeah, no, those are the only places I've been. Yeah.
Okay. Makes my job easier. Thank you. That's good. Okay. Great. So I've gone through everything on the app at this point as far as the questionnaire. I have a couple more things I wanted to talk about. Before we do that, is there anything else that concerns you at this point? Maybe something we haven't
No,
talked
but
about.
I'm going to have to get going pretty soon. So what else did you need to talk about?
A couple of quick things. One is once everything is okay, the app will show you that you could also donate plasma. And if you do donate plasma, you could save 3 lives. And so it's very, very helpful if you are okay with doing that. You simply update the app and put yes. And so you don't have to do that now. We could do that later. And should you need support, again, it sounds like everything's okay, but if there's any help that you need, you simply hit yes on peer support, and someone from Larkin volunteer team will call you. And then the couple of things that I do want to go over is over the next 24 hours, if you can log in to the COVID Fighter app for me and just update your symptoms, or if anything changes with your symptoms, if you can just go ahead and update the app, that would be very helpful. And that will actually help you track to see when you're clear as far as this disease is concerned, and that when you can actually donate plasma as well. Is that okay?
I just have to do that for 24 hours?
Yeah, unless you have symptoms, then if you can keep logging in, it'll be, for the next 12 hours, 2 times. And then also if your symptoms change.
Okay.
Okay. And then lastly, I know you're trying to get off, that you have other things you have to get done. And again, I really thank you for your time. One last thing that I need from you. I will send you a survey via email. If you don't mind just providing your feedback on how our call went today, that would be very helpful. This is an all volunteer group, and we're new at this, and any feedback you can provide will be helpful to us.
I can do that, sure.
Awesome. Awesome. Well, thank you so much for your time. If you do need anything, I can give you my phone number if you'd like.
Yeah, I think I'll be okay. Yeah.
Okay, great. Well, everything is on the app. Just log in. Again, I appreciate your time and for doing your part.
Great. Thank
Okay.
you.
Have a good day.
All right. Bye for now.
Okay. Bye. And so when you're done speaking with your PUI, and you've gotten the information that you think you have, it is always helpful to go through the app one more time. I often find myself writing notes during the call because it's quicker for me to write it down rather than updating the app. And so at the end of each call, I go through the information, make sure again that I've updated the intake information, that I've updated the PUI status. In this case, I'm done with the interview with the PUI and I'm ready to contact the contacts. And so I'm going to go ahead and hit contact interview in process. We're going to have another video that shows how we contact a contact and so we'll go through that next. But for now, it's important that you update that so that in case you have to log off and come back to it, that you're ready to begin with the contacts. On the notes, I often also remind myself additional information on here. In this case, I've talked to the person, and in this case, I promised him I was going to go ahead and call his contacts an hour from now. And so I'll go ahead and put, for our purposes today, after 12, then just to give him time to talk to his contacts. Oops, okay, my computer's a little faster than I am. And so I'll just put call contacts after 12. And any other information that might help you or someone else, if there's another CTS that takes over, this is the information. This is where you could put the information. Earlier today, I mentioned if someone speaks a different language, it also helps to put that information in here if they prefer Spanish-speaking CTS, for example. This is where you would update and hit save. And just make sure that you have everything else updated accordingly in here. Person has not been contacted by the health department. The information is on there. And that's pretty much it. And when you're done, you can simply go to CTS control, and an hour from now, you're going to go ahead and call the contacts as you promised. If you have time and able to take on the next PUI, just hit CTS status, hit ready, and you'll be assigned another PUI as soon as one is ready as well. And you'll get an email and you can move on to your next PUI. Thank you for your time. I think that covers everything that I have.